What's up guys? Welcome back to my YouTube channel and welcome to today's video. It's gonna be a little bit spicier than my videos have been thus far, and it's because we're talking all about postpartum sex. Yeah. Essentially, I wanted to make this video because when I was about to have sex for the first time again postpartum, I was so nervous about it, and I actually went on YouTube to see if there were any videos that would kind of help me with this, but I couldn't find what I was looking for, and I was like, okay, I'm just gonna make the video that I wish that I had that covers all things physical, all things mental, emotional, basically like tips and tricks and ways to handle this and navigate it as husband and wife together. And so that's what this video is going to be about. And essentially, because there's going to be some different things we're going to talk about, there's going to be timestamps in the description box below. So if you want to skip ahead to the physical or to our conversation together about this topic, then feel free to do that. In a minute, this is actually going to transition into an interview that I had with my pelvic floor PT, Jess. I started seeing her as of 6 weeks postpartum, and she was the one that helped me kind of get back into, I was gonna say the saddle, but that sounds
back in
like,
the saddle. God bless you, Jess.
And I could have like talked about it all from my own perspective, but she really is the expert on this, so I'm gonna transition it over to her. But before we do that, I wanted to give you guys the disclaimer that if you have kids in the room, I know that some of you guys have told me that you watch with your kids. This is gonna get very like anatomical, and so depending on where you're at in conversations with your kids on the topic of sex, you may want to either watch this later or have them leave the room now. So that is your disclaimer for that. But also make sure that you subscribe to my channel if you are interested in more content like this. We would love to have you stick around. So without further ado, let's dive into the conversation with Jess. Well, welcome Jess to my YouTube channel. I'm really glad that we were able to make this like little conversation work to fit into the video, because as soon as I thought about filming a video about postpartum and sex specifically, I figured like I'd basically just be sitting down and sharing some of the stuff that you taught me. And I was like, why don't I just get the expert in the room on the call and we'll talk about it together? Because for people that don't know, Jess is a pelvic floor physiotherapist. She's my pelvic floor PT as well. So she has been so instrumental throughout my entire journey with like pregnancy, with labor and delivery. You coached me through a lot of that stuff. You obviously weren't in the room, but there was a lot of prep that we went through together. And then with postpartum as well, like you have been so huge in all of that. And so thank you for that. But thank you also for being willing to just sit down and talk about postpartum sex specifically, because I know that that can be a really big, scary thing for a lot of women, especially myself. So thank you for being here.
Thank you so much for having me, Beth. I'm excited to talk about it. I love to talk about pelvic physio, so I'm more than happy to be here.
So the first question that we had kind of talked about a little bit was specifically why a pelvic floor PT should be the one to clear you for sex and exercise. So a lot of the times you go and see your OB and then they just kind of look like they don't really do anything beyond that. They just look and they're like, looks good, go ahead. But a lot of the times that's not necessarily as easy as it is for some women to get back into sex specifically. So what does that look like? Why should you see a PT first? And what is that process for women?
Totally. Great question. So I know you already spoke a little bit to your experience, but most women postpartum don't have a follow-up with their OB or their midwife till that 6-ish weeks post point. And really all that happens at that appointment is that your OB or midwife will check for tissue integrity and basically say, okay, looks good, and go ahead. And I think the reality is that everything in terms of pelvic floor physio, in terms of your pelvic floor and that recovery, is the furthest thing from one size fits all. Every woman has a very unique sort of birth story, labor story, recovery story. It's incredibly individual. And I think it's super, super important that you as the new mom take some time to kind of explore what your recovery looks like. And pelvic physio is a really big part of that. So obviously we have the training and the time to do sort of a really detailed and specific assessment of not only your tissues, if there's scarring or tearing or anything that needs specific attention in terms of recovery. But we also have the time to sort of look a little closer at what your goals are, at how those tissues are healing, at how well sort of your pelvic floor is working and functioning, and can help meet sort of more specific goals that you might have as a mom in terms of recovery. Our time and skill set is a huge asset that women need to take advantage of, because it's a really huge life transition to go from having a baby to diving back into everything that your life sort of entails.
What would you say is like, when it comes to waiting to have sex, a lot of people are like 6 weeks, let's go for it. Is there like a recommended amount of time to wait to have sex? Is there like an average time that you usually see in all reality, all things considered?
Yeah, super great question. And I think, again, this speaks to sort of the importance of having that pelvic physio assessment, because again, it is super variable. Like some women that have very smooth deliveries, or even maybe a cesarean section and don't have a lot of scar tissue or a lot of sort of vaginal trauma, have an easier time returning to like penetrative sex or intercourse. Whereas depending on the level of sort of vaginal trauma, so really it relates to the amount of tearing that you might have experienced during your birth, that drastically impacts the level of pain you experience during that return to sex and how long that timeline will be. So again, it is super individual. So it can range anywhere from 6 weeks to 6 months. Like, I think there's a really interesting stat that about 1/3 of women are not back to having sex 6 months postpartum.
Wow.
Yeah, it can take a long time. And I think it's important to recognize that and be comfortable with the variability within that, and know that your story might be different from your girlfriend who also just delivered.
You mentioned cesarean. So is that something that you would do as well, as have like C-section moms come in and also get the same kind of assessment and see where they can go from there?
Yeah, absolutely. So with cesarean births, like I always find it's very important to prepare for that possibility. I know you and I chatted a bit about it during your birth prep, but again, like 1 in 3 births in Canada is a cesarean birth. So even though maybe it's not a vaginal delivery, it still will impact the pelvic floor. Often a lot of women do trial a vaginal delivery and then end up in cesarean births or a C-section birth. And that obviously will not spare the pelvic floor from the trauma that it might experience. But even if it is a scheduled or planned cesarean section, there's a lot of relationships between like the muscles and the fascia from the belly and the pelvic floor and the space in the pelvis. So obviously during a cesarean section, you're cutting through layers of fascia and tissue and muscle, and then getting sewn back together once that baby's been delivered. That's a massive procedure, a huge surgery, and it takes a lot of recovery there as well. And again, in a similar way, obviously an OB will give you that 6-week clearance, but there can be sort of adhesions through the scar tissue, lots of pulling and pain. And it's important to make sure that we're addressing those things, not only for return to life and exercise, but return to sex for our cesarean moms as well.
So when it comes to either like right after that 6-week mark before you have sex, or say you're a mom that started to dive back into sex, but you're noticing that something may be off, or it doesn't like feel the way that it once did, or it's uncomfortable, what would be some signs that it's a good time to go and have an exam with a pelvic PT?
So I think in general, there's a lot of sort of signs and symptoms of what we call pelvic floor dysfunction that we often say. A big sort of common phrase in pelvic physio is that symptoms may be common, but that doesn't mean they're normal. So there are a lot of things that new moms might experience during those first couple weeks and months postpartum. And just because maybe your friends are experiencing the same things doesn't mean they're normal symptoms. So some of the things that we look out for are things like leakage or incontinence, whether that's urinary or fecal, though obviously bladder leakage is much more common. Any feelings of sort of heaviness or pressure down there, sort of feeling of bulging or heaviness. Additionally, things like pelvic pain, whether that's with sex itself or just with movement, right? Sometimes even rolling over in bed can be pretty sore after going through an experience like a birth. Now, in terms of sex itself, right, often it's important to set those realistic expectations that, hey, it's going to feel a little bit different after delivering a baby than it did before. But it's important to recognize that sex should be comfortable. It should be fun. It's not normal for it to be painful at all. So looking out for any tenderness, discomfort, even with sort of external touch or stimulation, pain with orgasm, pain with insertion, increased friction or feelings of achiness with sort of deeper thrusting. All of those things are not normal and are things that we can treat in a pelvic physio session.
What if there has been like 8 months, 10 months, 11 months, whatever has gone by, and someone is still feeling some of these things? Or is it too late for them to come to see a pelvic PT, or is that still something that's on the table?
Great question. It's never too late. It's literally never too late.
Great.
I see so many women like 20, 30, 40 years post-delivery that may experience these symptoms and have been living with them for decades.
Wow.
And you literally do not need to. Like, please come see a pelvic physio sooner. But it really is never too late. Like, it can be quite life-changing for those women that have been living with these symptoms. But I hope that if anything, we can bring the education out there that you don't have to, like, take some action and take care of yourself sooner rather than later.
What would you say you can do to make that like first time back again, or first few times back again, a little bit less painful postpartum?
Set realistic expectations with yourself and your partner. Right? So much of returning to sex is a bit of a mental game, right? There's a lot of fear. There's a lot of changes you've gone through. You're overwhelmed. You've got a new baby. It's really important to recognize that your headspace and this new sort of life that you've entered will impact how that return to intercourse goes. And that throughout that process, if something is uncomfortable, if it feels different, you want to stop, say something. That's completely fine. And it's important to kind of switch it up, communicate, and recognize when it's not quite going right. But the main thing, obviously, that me as a pelvic physio can speak to is the physical prep. So again, I can't say enough how important it is to work with a pelvic physio to sort of release any scar tissue that might be causing adhesions or stiffness at the vaginal wall. Making sure that the muscles of the pelvic floor that create that vaginal wall are really nice and relaxed and ready to accommodate whatever might be inserted. And then, of course, making sure that you're just in a relaxed state. So there's lots of sort of stretches and breathing strategies that we can use to try and relax and make sure that those muscles are sort of ready for the activity.
Well, thank you so much, Jess, for jumping in. I know that even just the refresher of all of this has been very helpful for me. So I've been so grateful to have you in my experience. And now I'm just so glad that other people can have you in their own experience as well, whether they're still struggling with some stuff postpartum or they're kind of going into that stage now and just wondering how to prepare and how they can be best like ready for that. So thank you so much for sharing today. For people that are local to where we are in Waterloo, why don't you share a little bit about where they can find you, where you're at, if they do actually want to book an appointment?
Oh, great. First, I want to say thank you so much for having me, Beth. It honestly has been such a pleasure to be with you on your journey, and you've done amazingly well, and I'm very proud of you.
Thank you.
Yeah, I work at SOS Physiotherapy. So I work locally in the Kitchener-Waterloo region. The location that I work out of is in Waterloo, sort of at Northfield and Weber. And we also have 2 other locations, one in Kitchener, one in Elmira. And there are wonderful pelvic physios that work at each of those locations as well.
Thank you so much, Jess. This has been a great conversation.
You are so welcome. Thanks so much for having me, Beth.
Well, I hope that you guys enjoyed that little interview with Jess. I think we wanted to take some time just to talk about sex from a postpartum perspective as husband and wife. I think for us, we were able to do it again around 8 or 9 weeks postpartum. So I went to my OB at 6 weeks and basically like they just look at it and they're like, you're good to go. There was nothing outside of that. And if you guys watch my channel, you would know that I did have a 2nd-degree tearing with Vivian. She was not a small child. And so coming out of that, I was very, very nervous. And at 6 weeks, I definitely didn't feel physically ready, mentally ready, emotionally ready. And those are some of the things that we kind of want to talk about today. For you, like you were in the room. You saw what was happening. Like you looked on the other side, even though that you said that you weren't going to. You actually did do it.
I know.
And so you saw what was happening. Did that like make it harder for you mentally? Like how did you distinguish between like this being just like a birthing, like, you know what I mean? Like how did you do that?
Yeah, that was the thing that I was most nervous about going into your pregnancy and like the actual like giving birth was if I look and if I see anything, is it going to ruin my like perspective for the future? and like the future of having sex. And I talked to a couple of guys that I trusted beforehand that had kids, and they were like, no, it doesn't. It's a completely different thing. Like, you almost categorize it in two different spaces in your brain. And I wasn't 100% like sure or I really believed them. And then I couldn't like help but look when you were giving birth, and it was like, this is like really like once in a lifetime for Vivian, and like I've got to just like see it, and then I'll figure it out afterwards. And I saw it, and it was like different. And I never really like, I didn't watch like birthing videos beforehand. I'd never come into contact with that, so it was shocking. But I would agree with all of the other guys that I was talking to. Like, you do kind of categorize it differently in your mind, where it's like, this is like playing a function right now versus like this is like something I like want or am attracted to or desire, you know what I mean? They're very like, they're not even like the same thing. I don't ever desire that other thing, but you can kind of keep them separate in your mind.
Because it's a hard thing, because I feel like men are so visual, like, and I know that you are as well, and so like that, I think even for me, like how you felt about it was one of the mental things for me that made me afraid to have postpartum sex, because I was like, what if he just sees this as like a birthing canal now, like,
or afraid for me to see it when it was happening.
Now,
granted, everybody's different. I have like a pretty like weak stomach in general, and so that was hard for me to see. Like, Vivian, like I had to look away at like because
there's
of
a
just
clip
like
in our birth vlog, which I'll link here, of you literally being like
it was intense. But that's why like afterwards on that recovery journey, I did as much as I was able to, as you needed, but you also like helped me by just taking care of like everything down there until we were sort of like back at a relatively normal place. Because you were wearing like those like diaper things out of the hospital for forever, and stuff was coming out like crazy. I remember seeing some of those as you were throwing them away and being like, that is a lot of stuff.
Welcome to the life of a woman. Physically, it did hurt quite a bit, but mentally it was hard for me to like reconcile some of the feelings that I felt with birth, and then also like to think of anything else going in there ever again, basically. Because like I was seeing what was happening recovery wise, I had like felt what was happening birth wise, and so then literally the thought of anything going up there was like so scary to me, even though I didn't know how it would feel in those like first couple of weeks postpartum, well, like after the 6-week mark. And so mentally I was just like, it's gonna hurt so bad, like my tear is gonna like fully just tear again. And I remember at one point talking to Jess, I was like, how hard would we need to go at it for the entire thing to just rip apart again? And she's like, don't worry, that's not gonna happen. Like, you would have to be like going really aggressively. And so that was one thing that I had to like mentally overcome, was like, it's going to be okay. Like, especially because like physically I had a lot of what they call phantom pain, and so where the tear was, like I was feeling like the skin was like burning or like tearing apart again, even when it wasn't. And so basically the only way to kind of overcome that is to like obviously be very gentle with it, but you have to just start stretching that skin out again, because it's scar tissue that is like, in order to be able to feel properly again, it needs to be like re-engaged. Nothing is going to like tear apart and rip apart again. And then also, this is something that I wanted to put in here because I feel like at some point it comes up for like most women that do breastfeed, and a lot of the people that I've talked to that are pregnant right now have asked the question of like, does breastfeeding like change the way that you're able to like interact like in sex with your
nipples?
Like with your spouse. And I again would say like what you said of that categorization definitely came into play as well, where it was like you see them as two different functions in two different spaces. Like, it didn't feel like, oh my gosh, I don't want him to see them because like this is where like I feed the baby from or anything like that. Like, that was okay. And so I feel like mentally those were the two biggest things for me to overcome, but having just like open communication was what made the difference.
And it's similar to like the different functions of those like parts of your body anyway. I'm having a hard time saying stuff, and I think I didn't really worry about that too much. More of what I was worried about is like was like breast milk and like
all over your face.
Yeah, exactly.
Okay, so we've covered physical, we've covered mental, but then the other big piece of it is emotional. And I feel like the emotional side probably impacts women a little bit more than men. Like, I don't know if you would say that that's a fair assumption.
The emotional side?
Yeah, like you're pretty like physical and mental when it comes to sex, but would you say that emotional would have like impacted you in the same way?
No.
Yeah.
Less.
After you have a baby, your hormones are just absolutely whack for the first little bit. And like even 6 weeks postpartum, supply was like starting to regulate a little bit more. And so with that, there came a lot of postpartum anxiety for me because I was nervous that I wasn't going to make enough for my daughter. And so then I'm balancing anxiety, like as a new mom, I'm balancing anxiety as a new wife. Like overall, it's just like a very emotional time. And then you add in a lack of sleep, and both of you kind of like being like kind of at each other a little bit more just naturally with that. You add in, like in my last video, we talked a little bit about husband resentment, where it's like, okay, I'm awake with the baby all night, like watching you sleep beside me. And so there's all these different things that you can add in that for a woman can be really hard emotionally to kind of like get yourself to a place where you even want to have sex, because it is like such an emotional thing for women. I know, at least for myself and a lot of the women that I've talked to. For myself, it was a lot of just like bringing you into where I was at. Like if I struggled kind of in silence with all those things of like, I feel like I'm not doing a good job at this, or like was afraid to talk to you about the fact that I was nervous to have sex, or any of those things, emotionally, I feel like it would have been a lot harder for me to get to a place of like wanting to have sex and feeling that like connection. Because I think it's very important to like maintain that connection as much as you can when you have a new baby. With everything changing and everything being out of whack, like ultimately the main thing is still making sure that like your marriage is in a good spot. And of course that looks different in different seasons, but just like having that still be a priority amidst everything, like I think was one thing that helps just emotionally kind of like have me still be in a spot where like I did love you and I loved watching you with our daughter. And like I find a lot of the time for me, it is that like emotional kind of piece that like allows me to get there. And so if there were times that I wasn't necessarily feeling that, like I kind of knew that if we were to just like sit down together and chat, or if we were to like start kissing or whatever, then a lot of the times that emotional side does kind of like catch up with you physically. Also, lots of lube. That is one thing that I'll say is just like a basic recommendation, is like having lube in the first little bit, even if you didn't need it before, is very helpful postpartum, and just like kind of getting back into the swing of things and like having things be comfortable for you again.
Yeah, you want to make the whole thing as easy as possible,
Totally.
Especially when things are real sensitive and you're in your head a lot, and there's like a whole lot of things that are going on.
If you find you don't need it, then great, just don't use it again. But like using it the first couple times,
don't feel
really
bad about
helpful
using it like there's some problem or anything like that.
Like a phrase that I have been using often when it has come to postpartum sex, like for myself, but also when I talk to others, is this like male and female perspective of as long as it takes, but as soon as I can. And basically what I mean by that is like from the male perspective, it's like as long as it takes for them to be able to be in a spot where they're ready to do it again, like I'll wait. But for the female, having that perspective of like, as soon as I can do this and as soon as I can have sex again, I want to. Because like the reason that I say that is it's so important for marriage to have sex be a part of it. Of course there are things to navigate, but like do the work to help mitigate some of those things. Like go to pelvic PT if you're noticing that there's a lot of pain there, because there doesn't need to be pain there forever. There will be pain for a little bit, but any pain beyond like a certain amount of time, as just said, is not a normal thing. It's something that can actually be worked through. You don't have to live with it. And so be proactive in that. Be proactive in that, like taking care of your emotional side of things, of communicating with your partner about where you're at, both emotionally, but also mentally, but also mentally, and just like be a team, but also like don't take sex off the table forever. It's just not good for your marriage. And I have been there. I know how hard it is. I know that it was a struggle for me, but if I could just give you any advice, like from a woman to a woman, like in a marriage, like don't take it off the table. Be very open about it, but do what you can to help bring it back as soon as you feel like physically and mentally and emotionally ready to do that.
Yeah, and I think it's a good phrase that you have there, like as soon as it takes, as soon as it takes, as soon as it takes, and as soon as you can. As long as it takes, and as soon as I can. Because it's like, it's the same thing in marriage. Like, sex is just like an extension of your relationship. So if you have bad communication in your relationship, like sex is going to be hard for you to do and to be both like engaged in, because so much of sex is communication. I'm in it 100%. It's not 50-50. I'm in it 100% for you. You're in it 100% for me. And when I'm lacking, your 100% covers. And when you're lacking, my 100% covers. And I think that that's what's demonstrated in this phrase, where it's like, I'll wait as long as it takes for you to be in a good spot, and you're fighting to get back to a place where this is something that we can do as soon as you can. And
you have to trust that in each other. Like, I had to trust that you were ready to go as long as it took, and you wouldn't go cheat on me, or you wouldn't download like a porn subscription or something. Like, there had to be that trust with each other, and you had to trust that I was actively like doing what I could.
And that statement is a recognition of needs, and that's like another thing too, where it's like sex, like penetration isn't the only like
Yes, that's also a good
way
point.
to have sex and have intimacy and to be together. And so it's like I'm recognizing your needs in the sense that our frequency of being sexually intimate went way down in those like 8 months. And
Those
some
8
of
months.
those 8 months, holy heck. If it's taking 8 months, like, hey, do what you gotta do, but also
But
like do
also
some
go to a
PT
doctor.
therapy and other stuff like that too. But in those 8 weeks, like frequency of stuff went way down, but that didn't mean that my needs went down in that area. And so like I kind of ate some of that a little bit and was just like, cool, it's just gonna be like a tough time. But that meant that other things like became more challenging, like like some of the thoughts that were in my head, like that temptation to like look at pornography and all of that stuff. Which again, like pornography is just such a commonly accepted thing in our society, but again, it rewires your brain in some unhealthy ways in your relationship. But it's like you're helping me, you're recognizing my needs, and ultimately I'm recognizing your needs, and we're doing our best to meet in the middle at some place. But the understanding is I'm willing to like figure this out as long as it takes you, and you're willing to like accelerate. And I really felt honored and valued in our relationship that you went above and beyond to do stuff like PT, and you were really trying to get back on the ball. And that built trust with me that you weren't just like leveraging postpartum as like I don't like want to do this because I'm not into it, and so I'm just gonna like put it on a back burner. But you were like, this is a priority in our relationship, and you made it a priority even though it was challenging, and that built my like trust with you and respect for you and like appreciation of you, and it made me feel really valued and honored that you would go out of your way to like do something that you knew was important to our relationship. And I mean, hopefully vice versa, you felt that from me in that season, to go like, cool, I'm not gonna like, you know, make comments like, well, it's because we haven't done this in so long, or like or like try to press myself like all the time on you, or try to find situations where I'm like accelerating that process. But it's marriage with everything. You know that I'm 100% trying to like make this work for you, and I trust that you're 100% trying to make it work for me. And with that trust and foundation, we can like figure a lot of stuff out.
I'm sure there's women that are watching this whose husbands are making those comments of like, it's been so long, whatever, like you're gonna make me have to do this, or like I don't know if you would have any
You're
like
gonna make me have to do this.
like,
nah,
well, just
bro.
like some of the like the manipulation that can be involved with that, or just like downplaying what a woman is going through. Like, what would your advice be? I don't know, either to the woman in that position or some of the men that are in that position of kind of like pushing this a little bit too hard and fast on their spouse.
Well, I mean, that stuff is most of the time like people trying to communicate their needs without really knowing how to do that well. So first of all, like, it's not okay. Like, that's not an okay way to communicate with your partner, because it just makes them feel bad. Like, find a better way to communicate, and like sit that person down and be like, hey, listen, I'm sorry for some of the way that I've been saying some of these things, but it's because I'm feeling this, and like and that takes vulnerability, and that's probably where guys just like channel their vulnerability.
They skirt the vulnerability and go straight to anger.
Exactly. And I do that too. Like, I did that as well. And it took me going like, cool, I actually need to have a conversation to go like, listen, like these offhand comments, and like women do this too, like it's what's called like nagging or whatever, where it's just like I'm always like saying these underhanded comments, and it's like, no, find a better way to communicate. Like, I need to find a better way to communicate. I'm really struggling with this. I actually don't think you're trying as hard as you could be trying to move this ball forward, and I know that's hard for me to say, but like that's how I feel. Oh, well, I actually am. Let me help you understand why that's the case. And just being a little bit more open in your conversation, and seeing those like flags as ways to like open doors of communication, even though it's hurtful. And that's why it's just like, just don't be hurtful. But it's like when somebody is doing that, it's a flag.
Done when you're overtired.
When you're overtired and the baby's screaming,
ends.
100%. 100%. But it's not like an excuse. It's a reason. It's not an excuse.
And bring someone in that's a third party if you need to, because like obviously like counseling is a great resource if you're finding that your marriage is really struggling postpartum.
To approach with compassion, try to start a conversation, and like
see what other things you can do. Doesn't need to go in. We are back with the cutest little friend. The little lady that has changed things for our sex life drastically.
It's all because of
and
you.
It's also worth it because you're so lovely. Well, I hope that this video was helpful for you guys, and it could answer some of those questions or quiet some of those fears, or even just encourage you with wherever you are at in the pregnancy or postpartum journey. If you're watching this and you are in that place of just being a little bit afraid of what postpartum sex is going to look like, know that you will be okay. The pain doesn't last forever. I know that I also had moments where I was like, is this what this is going to be like now? But again, like being 4 months down the line, things are better. And I dare to say even better than they were before for us. For sure. And so there is a like silver lining to the things that you're feeling right now.
If you're like on before you're having a baby and you're like nervous about what's going to look like afterwards, you're going to figure it out. And if you are watching this afterwards and things are really tough right now in your relationship and like in this department, like you're going to figure it out too.
Yeah.
Just like stay in it, keep
stay
working
in
at it, and don't quit
Your
on it
marriage
because
is worth
it'll pass.
it. Yeah.
It's going to pass, isn't it?
Yeah.
Baby?
Yeah, it will.
Yeah.
Also, if you want to see more content like this in the future, then make sure that you subscribe to my channel. We are on the road to 10K, getting closer every day, and I would love to have you stick around and be part of just our little YouTube family. And so thank you guys so much for watching, and until next time, I love you guys. We are all praying for you guys, and I will see you soon. We're wearing the exact same color. This is not gonna be...
It's fine.
No, we look like a big blob.
No, we don't. We look like buddies.
We look like I should change. I'm gonna get... Just glitch. From a husband and wife perspective, slow down.
Yeah, just take
That's why I'm
breather.
tripping over my
I kind of want to go shopping.
shopping where?
I don't know. Like, Seth?
He just said he wanted to go to Home Sense. Did you hear that?
We did it, big girl!
Good girl.